I'm Dr. Robin Farias-Eisner, the Academic Chair of the Department of Obstetrics and Gynecology at CHI Health. I also have a couple more roles. I am the Executive Medical Director of the Women's Health Line at CHI Health, and also the Director of GYN Oncology here in the organization. My research began at UCLA looking specifically for biomarkers to identify early stage ovarian cancer for a variety of reasons, the most compelling of which is that ovarian cancer typically is diagnosed later, in later stages, stage 3 or 4 in the majority of patients. So to that end, we were looking for blood markers that would identify patients with early stage ovarian cancer before it could even be seen on imaging and before the patient had symptoms. That includes patients that we believe to be at clinical risk because of family history syndromes and because of a variety of other issues that might put them at risk. We identified 5 proteins in the blood of patients that could very accurately identify patients with early stage ovarian cancer. This ultimately was marketed and commercialized by Quest Laboratories. UCLA partnered with Quest Laboratories and under the marketing OVA1 Plus, which is a multivariate index assay that will identify changes in these protein levels. So upregulation of 4 of the proteins, downregulation of 1. It proved to be a very effective modality with high sensitivity, high specificity, very high positive and negative predictive indices. The clinical trials are complete and have been very encouraging, and so now it's being used internationally. The interesting finding is that one of the proteins was down-regulated, we found, rather than upregulated, meaning that it decreased significantly with increasing stages of ovarian cancer, and that was puzzling. So our hypothesis was that perhaps the decrease in this protein called ApoA1, which interestingly makes up the HDL or good cholesterol molecule, was associated with an increased risk for developing ovarian cancer. That is to say, the depletion of ApoA1 in the blood was associated by creating a microcellular environment, permissive environment for tumorigenesis. So we tested that hypothesis by creating transgenic mice with multiple copies of this ApoA1 gene, and sure enough, no matter what we did compared to the control group that didn't have the gene, we couldn't give these mice cancer. We couldn't induce cancer. So that was proof of principle that this gene or this protein that is the result of gene expression was protective. So we thought, why not use this as a new drug? Therefore, those patients that are at risk or that already had the disease, we could administer ApoA1, the ApoA1 protein. Unfortunately, it's a very large protein, 250 amino acids, so there's a lot of folding. If you ingest it or inject it, it denatures. That didn't work. So we were going to give up on that approach when we recognized that the world of peptides. So any protein has a little fragment of amino acid sequences that function like the promoter region or the functional unit that drives the function of the protein, sort of the brain of the protein, if you will. And we had to find those amino acid sequences, which we did. And we used that short sequence or peptide in lieu of the parent molecule as the therapy. And that proved to be a winning strategy, and we patented that technology, and we were issued both the use and the composition of matter or sequence. But the Supreme Court ruled that no scientist could own naturally occurring DNA or protein sequences as drugs. But by that time, we had already started experimenting not just with ApoA1, but other constituencies or moieties of the HDL molecule. They're all apoproteins or lipoproteins. So we started doing fusions of these brains or these functional units, ApoA1 to ApoE, ApoE to ApoJ, and that proved to be even more effective, that these fusion or chimeras or hybrids were supercharged and more effective. And they're not naturally occurring. So the patent office granted us the composition of matter patent, which is an honor to be granted that kind of patent in this country. And then quickly following suit, the UK, the EU, Commonwealth countries, and selected countries in Asia did the same. So we have quite a nice, robust portfolio. We have the beauty of this type of work is these peptides have no side effects. And treating patients with conventional chemotherapy can be prohibitive because of the side effects. And now with these agents that have no side effects, that opens a whole new door so we can enhance efficacy and still preserving a very favorable toxicology profile. So we now have a portfolio of these peptides, and the way the patent was issued is to use these as prevention and treatment for all pro-inflammatory conditions, not just cancer, recognizing that these peptides, because of their origin within HDL is a wonderful molecule that spares us atherosclerotic heart disease, Alzheimer's, any pro-inflammatory condition. So we are now using these drugs to test their efficacy against not just cancer, but all pro-inflammatory conditions, even macular degeneration, inflammatory bowel disease. It goes on and on and on because most human conditions are pro-inflammatory.